So today we'll be dealing with a series of lectures on clinical cardiology. So the series of lectures, the points we'll be discussing will be entirely based on a clinical discussion. Okay, so it will be starting from the discussion from JVP, pulse, heart sounds and murmurs. So at a stretch, if you see in NEET, in cardiology, if you see, minimum 5 to 6 questions will come, among which 3 to 4 will be from the clinical cardiology aspects. So let's start from the first topic, which is JVP. So this is the lateral side we are seeing. Here, if you see in the neck, we can see the carotid arteries and the jugular veins. So these jugular veins have the great tendency to tell the pressures in the right heart. The pressures in the right heart is directly reflected by this jugular veins. Okay, so jugular veins, if you see, there are two, internal as well as external jugular veins. So both these jugular veins join to form the superior vena cava and drain here. Okay, so this, if you see, internal jugular vein and the external jugular vein both drain into the SVC and they drain into the right atrium. So can you see, this is like whatever pressure changes in the right atrium, this will be reflected in your neck as a pulsation. This is called jugular venous pulsations. Okay, so obviously there will be a doubt with you, like there is a pulse here called the carotid pulse and there is a jugular pulse. And among the jugular veins, what jugular vein are we going to use to see the JVP? It is nothing but internal jugular vein. So my question is, in the neck, if you see, there can be two pulsations, like one of the jugular pulsation and one of the carotid pulsation. Now our question is how to differentiate, or whether clinically as a physician how are you going to differentiate that pulsation, or in an MCQ aspect how are you going to differentiate it by clues. See, first thing is carotid and JVP. Carotid is a arterial pulsation. Okay, and jugular is a venous pulsation. Obviously, arteries will be pulsating with each systole and obviously you can palpate it. Okay, so obviously it is palpable. But this JVP is not palpable since it is a venous pulsations. Next, if you see, JVP, if you see, like it changes with change in position. Why? Because change in positions, like in supine posture, what will happen? If the patient lies to supine posture, what will happen? The venous return actually increases to the right heart. So that time, if right heart venous return increases, the pressures will increase in the right atrium and that will be manifested as some elevations in JVP. And if the patient stands, what happens? Venous return decreases, their pressure in the right heart decreases and jugular venous pressures also decrease. So you can see that it is a direct measurement of your right atrial pressures. You can obviously see what is happening with the right atrium and right side of the heart. So obviously it varies with change in posture. But does carotid change with changes in posture? Obviously not. It is governed mainly by the pressures, arterial pressures, and high pressures in the left side of the heart. It won't manifest that much with change in posture. Next, obviously carotid pulse is non-compressible. Okay, due to the high pressures within it, it is obviously not compressible. But JVP, jugular veins, can be compressed.